Good evening to all. The 60th medical term that we'll be discussing today is polio. Yes, it's an infectious disease. The complete name would be poliomyelitis. It is caused by a virus that generally ends up causing paralysis and death of an individual. So, this polio virus has different strains, that is PV1, 2, and 3. And the reason for leading to a paralysis is because it affects the central nervous system, that is the brain and the spinal cord. So what are the main ways of transmission is one is through the fecal oral route. So if the polio virus is present in the stools, then when contact with the stools, then and especially when we eat contaminated food and water, and if they are contaminated with the stools which contains this virus, then there is a possibility. Then the other possibility is respiratory droplets, so sneezing and coughing. But of course, this route of transmission is actually very less effective. And of course, through the gastrointestinal tract. So when there's a fecal oral route, obviously through the mouth also it can enter. So the main problem here is it can cause non-specific symptoms like flu, but at the same time specific conditions like meningitis, inflammation of the meninges, the membranes that cover the brain and the spinal cord. So the protective layers are affected, so that will invariably affect the organs. And then, of course, a paralysis. And this can lead to paralysis because with the peripheral nervous system, uh, from the central nervous system, the peripheral nervous system also can get affected. So the impulses, the transmission is affected. So that can lead to death. So there is no proper treatment, but of course we can prevent it using vaccination. There are two types: inactivated polio vaccine and oral polio vaccine. So inactivated is when you're using a killed virus, but oral polio vaccine is usually consists of the live polio virus. So there can be chances of reverting, but still they are in a reduced antigenic form. So therefore, less of side effects or less of adverse events occurring. So these are the two uh, vaccination procedures that are used against polio.